Now, the world is observing World TB Day today under the theme, Yes, We Can End TB. In South Africa, there were an estimated 304,000 cases reported in 2022. This is over 3.3% of the global TB cases. This year's campaign aims to lobby heads of state for political support ahead of the United Nations high-level meeting on TB in September. Joining us now for a discussion on this is Russell Rensburg, who's the director at the Rural Health Advocacy Project. Russell, thank you for making time for us. So you've released your 2023 edition of the State of TB report just this week. It looks at the governance of TB programs in the country. What gaps have you uncovered in this report?
I think, firstly, obviously, we've just come out of a 2-year pandemic. You know, we health and the governance of health has really been on the lips of everybody. It cost us billions of rands responding to COVID. And we released the report last year on the state of TB, and given the significant impact that COVID has had on TB notifications and cure rates, we thought this year we'd dig a little bit deeper in trying to understand what would be the enablers to allow for a more effective response. And through that, we looked at different governance frameworks. We used a framework developed by the United States International Development Agency that allowed us to assess the South African response against the response of other countries. And with that, I think we found a number of different gaps. More specifically, it's really just around the coordination and the management of the TB response. We have very good science in South Africa. We have very good technical guidelines on the implementation of policy. And we also have really good strategies. And I think where we found that we were falling down a little bit was on issues of transparency, on issues of community involvement, and also really just general coordination of the program. And I think that's what's costing us in our fight against TB.
Is there any program that you have identified in the implementation of the plan government has?
Look, I think obviously the plan was based on the TB recovery plan.
Yeah.
Right? And I think when you look at the implementation of the TB recovery plan, you have to look at the institutional arrangements that govern health in South Africa. So the National TB program is located obviously in the National Department of Health. As we all know from the NHI discussions, that health is a concurrent responsibility between national and province. So national creates the guidelines and the framework for the response. And because this is so unclear, many of the provinces each approach that national legislation in a different way. So we don't really have a very well integrated or synchronized response. And we don't have a universal measurement framework. So each of the provinces measure their performance in a different way, which makes it very, very difficult, firstly, to evaluate, and then secondly, to ensure accountability for implementation. So I think one of our main recommendations is that we need to strengthen the National TB program to be better coordinate the implementation of these strategies across provinces.
How do we do that? How do we bring about coherence in the implementation of these TB programs?
Look, I think we have to use the provisions within the National Health Act to do that. You know, we don't really have to come up with new laws. I think we need to just give content to some of these laws. So at the first level, we know that the National TB program is a sub-program within the National Department of Health. So they're not really represented in the highest decision-making body within health, which is the National Health Council. We need to address that. The second thing is we need to look at, obviously, the relationship between the national department and each of the provinces, and the extent to which we can implement one universal measurement framework so that we can let the data lead us and lead our decision-making. And then the third thing is we really have to strengthen community participation at all levels of the health system, from the local level, at the clinic or the facility, to the national level, so that the community can start becoming involved in the response and not just the subject of the response.
And how important is that community involvement? What benefits is government going to see when it starts involving the community at that level and extensively?
Look, I think at the first level, we've sort of done a little bit of a situational analysis, talking to communities around the country, around the involvement and understanding of health governance. But I think the important thing that we need to reference here is when you look at the Global TB report, we identified over 300, or it's estimated that over 304,000 people newly acquired TB in 2021. When it comes to the case notification rate, which measures the amount of people that actually had an active TB diagnosis, only 174,000 people got a diagnosis. We're missing about 120,000 patients. And because TB is so much located in the community, right, the community has to be involved in raising demand and awareness and understanding. And not just as the subject of the response, but they could also contribute to meeting targets at a local level. So the clinic committee can set up its own targets. The community involvement within that clinic committee can ensure that where's the gap? How can we talk to our stakeholders, either people living with HIV, the churches, the schools, in ensuring that we drive up the number and get as many people tested for TB so that we can introduce them into life-saving TB treatment, because TB is preventable and curable. And there's also now preventative medication that if people can access that can protect them against TB.
What is the reason that, because people do get tested, they get that preventative medication, treatment medication, but then some of them don't complete their treatments? What are some of the reasons for that?
Well, I think, we were listening to a lecture, the Stephen lecture from Madhu Pai last night, and I think one of the things that he noted that I thought was quite interesting is, firstly, TB, even though everyone can get TB, it generally is concentrated amongst the poor, right? And the poor don't always have like a linear approach to accessing healthcare services. Sometimes we move around between different facilities. Sometimes we move between provinces to look for economic opportunities. And sometimes, like in rural areas where some of the case notifications are the lowest and the cure rates are the lowest, the health facilities are actually quite far from where the people are. So it takes a significant investment. So I think there are two challenges. The first challenge is to get people tested. The second challenge is to provide them with enough support during the treatment process so they can complete the treatment. But in South Africa, we actually do relatively well, right? When it comes to TB completion rates, that those are the people that are initiated into care, our cure rates are in the upper 70s and close to 80. Our big problem is really linking people to care, and a lot of that has got to do with the fact that almost, according to Emily Wong and others, almost half of TB presumptive cases in South Africa may not show any symptoms. So people won't know that they're sick.
Do you think we still have momentum, though, in the national fight against TB? Because I think what COVID-19 did is let us put other pandemics like your TB or HIV on the back foot. So is there still that momentum in fighting this disease?
Look, I think we can re-energize that commitment. And I think one of the things that the Director General from the WHO said in his statement in early 2023 is really we have to start thinking about reorientating our health systems. What COVID did was, because a lot of the response was care-based, we really strengthened our capacities in hospitals. Right? Now we need to be able to start that process of reorientating our health system away from hospice-centric care and strengthening primary healthcare systems. And TB, HIV, maternal mortality, NCDs, the first point of contact that people have with the health system must be at the primary healthcare level. So as much as we place an emphasis on TB and HIV are also important pathfinders for strengthening primary healthcare services overall. We've also developed significant capacity during COVID in the management of health information and bidirectional information flows. We can use that same lessons to improve how we govern our healthcare system by strengthening the information gathering on things like TB, as well as how that information flows both up the chain to national and down the chain back to communities or back to clinics, so that we can able to use that information to guide our implementation as well as improving our governance and accountability. So I think all's not lost, and we actually have good foundations now to double down and start addressing some of these longer-term challenges that we've had in the system.
Russell Rensburg, thank you so much for making time.
Thank you very much, Clement, and thank you for the opportunity to share our story.
All right.